What if I told you that the bedtime advice your doctor gave you about stopping all food after 7 p.m. is only half the story? Would you be surprised to learn that some liquids before bed can actually lower your morning blood sugar? A 2023 study in the Journal of Clinical Endocrinology and Metabolism followed 147 adults over 60 with type 2 diabetes. The results? People who drank a specific nutrient-timed beverage before bed saw their fasting glucose drop by an average of 23 milligrams per deciliter. The group who drank nothing saw zero change. So why isn't your doctor telling you this? Here's a question for you right now. What's your average fasting blood sugar when you wake up? Type the number in the comments. I read every single one. Today, I'm sharing 5 bedtime drinks that clinical research proves can lower your morning glucose by 10 to 30 points. And I'm warning you about 3 so-called healthy nighttime beverages that are quietly spiking your blood sugar while you sleep. One of them is marketed directly to diabetics. Another is hiding in almost every pantry in America. But first, let me ask you something. Have you ever gone to bed with a perfect blood sugar, say 110 milligrams per deciliter, only to wake up at 145, even though you didn't eat a single thing? Why does that happen? It's not a mystery, it's your liver. Around 3 a.m., your liver starts dumping stored glucose into your bloodstream through a process called gluconeogenesis. In type 2 diabetes, especially after age 60, your liver never got the memo to stay quiet at night. That sugar raid is why your morning numbers are stubbornly high. The 5 drinks I'm about to give you work on 3 nighttime controls. Control 1, they suppress that 3 a.m. liver dump by improving overnight insulin sensitivity. Control 2, they trigger incretin hormones, the same ones drugs like Ozempic imitate, that tell your pancreas to be ready for morning glucose. Control 3, they deepen your sleep, which lowers cortisol, and lower cortisol means less glucose resistance the next morning. Sound good? Let's go. Let's start with the first drink. Do you wake up multiple times a night to use the bathroom? If so, try this first. Unsweetened almond milk. 1 cup has only 1 to 2 grams of carbs, compared to 12 grams in regular milk. But the real magic is magnesium, about 75 milligrams per cup. A 2022 meta-analysis in diabetes care reviewed 18 studies and found that magnesium supplementation improved fasting glucose and insulin sensitivity, especially in older adults who are often deficient. After 60, your kidneys flush out more magnesium. Low magnesium makes every cell more resistant to insulin. Could a simple mineral be the missing link for you? Now add half a teaspoon of Ceylon cinnamon, not the cheap cassia kind. Ceylon contains cinnamaldehyde and procyanidins, which activate your insulin receptors. A study in the Annals of Family Medicine showed that just 1 gram of cinnamon per day lowered fasting glucose by 18 milligrams per deciliter over 12 weeks. Recipe: warm 1 cup of unsweetened almond milk. Stir in half a teaspoon of Ceylon cinnamon and add a 1/4 teaspoon of vanilla extract if you like. Drink 30 to 60 minutes before bed. Cost: about 35 cents. Cheaper than any supplement. One caution: if you're on blood pressure medication, especially calcium channel blockers, magnesium can enhance the effect. Start with half a cup and monitor how you feel. Always check with your doctor. The second drink, I can almost hear you thinking, apple cider vinegar before bed? Won't that burn my stomach? That's exactly why we pair it with chamomile. A 2023 study in Nutrition Journal followed 64 type 2 diabetic patients who drank chamomile tea 3 times daily for 8 weeks. Their HbA1c dropped by 0.52%, and their fasting glucose decreased significantly. The active compound is apigenin, which binds to GABA receptors in your brain and also improves how your cells respond to insulin. Now add 1 tablespoon of raw, unfiltered apple cider vinegar. A landmark Arizona State University study found that vinegar before bed reduced next morning fasting glucose by 4% to 6%. The acetic acid slows down your liver's 3 a.m. sugar dump. But apple cider vinegar on an empty stomach can cause acid reflux, especially after 60. Chamomile is anti-inflammatory and coats your stomach lining. They work as a team. Here's how to make it. Brew 1 cup of chamomile tea, let it cool to warm, stir in 1 tablespoon of ACV with the mother. Drink it 45 minutes before bed. Too sharp? Add a few drops of liquid stevia. Let me tell you about Margaret, 67 years old. Her fasting glucose was stuck around 152 on metformin. She started this drink. 6 weeks later, her fasting glucose averaged 126. She said the first 3 nights she hated the taste, but by week 2 she craved it. What's one small habit you've been avoiding because it felt uncomfortable? The third drink. This one surprises people, but if you also struggle with joint pain or slow wound healing, pay attention. Real bone broth, simmered for 12 to 24 hours, is rich in glycine. A 2023 study in the American Journal of Clinical Nutrition found that glycine before bed improved fasting glucose and reduced oxidative stress in older adults with metabolic syndrome. Glycine also lowers your core body temperature, which helps you enter deep sleep. And deep sleep is when your body repairs insulin receptors and clears glucose most efficiently. The pinch of sea salt is not optional. After 60, your thirst signals weaken. You become mildly dehydrated overnight, which falsely elevates your morning glucose. A pinch of mineral-rich sea salt helps your cells hold onto hydration. Here's the recipe. 8 ounces of true bone broth, not boxed stock. Look for kettle and fire or make your own. Warm it gently. Add a pinch of sea salt and a crack of black pepper. Drink 30 to 45 minutes before bed. Calories, about 40. Carbs, less than 1 gram. Protein, 9 to 10 grams. That protein triggers a mild GLP-1 release, the same hormone that keeps your liver in check overnight. If you have kidney disease or protein restrictions, talk to your doctor first. For most people over 60, this is one of the most nourishing bedtime drinks you can have. The fourth drink. Have you been spending money on melatonin supplements? Stop. Tart cherry juice is one of the only natural food sources of melatonin. A Louisiana State University study found that drinking tart cherry juice twice a day increased sleep time by 84 minutes in older adults with insomnia. But here's what matters for your blood sugar. Tart cherries have a glycemic index of only 54, sweet cherries are 72. They're loaded with anthocyanins, which improve insulin sensitivity and reduce inflammation in your pancreatic beta cells. A 2023 clinical trial in nutrients followed 37 adults with metabolic syndrome. After 12 weeks on tart cherry juice, their fasting insulin dropped and their insulin resistance, HOMA-IR, improved by nearly 20%. But you cannot drink it straight. Pure tart cherry juice has about 25 grams of natural sugar per cup, too much before bed. Here's the hack. 2 tablespoons of 100% tart cherry juice diluted in 8 ounces of water. That's only about 6 grams of carbs. Still gives you the melatonin and anthocyanins. Brands I trust: Cherubundi, Dynamic Health, Lakewood Organic. Cost per serving, about 40 cents. Compare that to melatonin pills at $8 to $12 per bottle. Which would you rather spend your money on? Have you ever tried tart cherry juice? Did it help your sleep or your morning numbers? Type your experience in the comments. The fifth drink. This is the drink I save for patients whose fasting glucose is stuck above 140, no matter what they do. Fenugreek seeds contain a unique soluble fiber called galactomannan. When you steep them in hot water, the fiber forms a gel in your stomach that slows carbohydrate absorption for hours, well into the night. A 2024 meta-analysis in Frontiers in Pharmacology reviewed 12 trials with over 600 diabetic patients. Fenugreek lowered fasting blood glucose by an average of 28 milligrams per deciliter. That's more than some prescription medications. But here's what's even smarter. Fenugreek contains 4-hydroxyisoleucine, an amino acid that stimulates insulin secretion only when glucose is present. That means it won't cause dangerous middle-of-the-night hypoglycemia. It's a self-regulating system. How to make it. 1 teaspoon of fenugreek seeds, Indian grocery store or online, about $4 per pound. Add to 8 ounces of boiling water. Steep for 10 minutes. Strain. Drink warm 30 to 60 minutes before bed. Add lemon or stevia if the taste is too bitter. Let me tell you about Robert, 72. His fasting glucose was consistently between 155 and 160. He started fenugreek tea every night. 8 weeks later, his average was 129. He said he could barely believe his meter. One caution: fenugreek can interact with blood thinners like warfarin, and if you're on insulin, it may enhance the effect. Monitor your glucose and work with your doctor. Some people notice a maple syrup smell in their sweat after a week. Harmless, just a quirk. Now, before you run to the kitchen, I need to warn you about 3 healthy bedtime drinks that are sabotaging your numbers. Are any of them in your pantry right now? First, herbal tea with natural flavors. It sounds innocent. No caffeine, no sugar on the label, but read the ingredients. Natural flavors is a loophole. It can legally include sweeteners, sugar alcohols, and fruit concentrates. A study from the Center for Science in the Public Interest found some flavored teas contain up to 4 grams of hidden carbs per serving that don't appear on the nutrition panel because of rounding rules. 4 grams right before bed, when your metabolism is slowest, can keep your body from entering the fasted state you need. Brands to watch: Celestial Seasonings, Sugar Cookie, Sleepy Time, Bigelow Vanilla Chai, Yogi Bedtime. If natural flavors is in the top 5 ingredients, skip it. Have you ever checked the label on your bedtime tea? Second, bottled golden milk. Golden milk is trendy. Turmeric is anti-inflammatory, but the pre-made versions at Trader Joe's, Whole Foods, and Starbucks are sugar bombs. A 12-ounce serving has 16 to 24 grams of sugar, from coconut sugar, date syrup, or agave. Your pancreas doesn't care if the sugar came from a date or a donut. It's still glucose flooding your bloodstream right before you lie down for 8 hours. Want golden milk? Make it at home. Unsweetened almond milk, half a teaspoon of turmeric, a pinch of black pepper, a drop of stevia. That's safe. The bottled version is not. Third, diabetic nutrition shakes like Glucerna and Boost. This one makes me angry because it's predatory marketing. Glucerna has 23 grams of carbs per bottle. Boost Glucose Control has 25 grams. And they contain maltodextrin, a fast-digesting carb with a glycemic index higher than table sugar, 85 to 105. The label says designed to minimize blood sugar spikes. What they mean is that added fiber slows it slightly. But a 2022 review in Diabetes Therapy found that these shakes caused post-meal glucose spikes of 40 to 60 milligrams per deciliter when consumed without food. Before bed, that spike happens while you sleep, triggering an insulin surge and disrupting your sleep architecture. It sets you up for a higher fasting glucose in the morning, the exact opposite of what you need. If you genuinely need a bedtime snack because of nighttime hypoglycemia, have 10 almonds and a piece of cheese. Real food, no marketing lies. Here's your simple 4-step system. Step 1. Pick one of the 5 good drinks and commit to it for 2 weeks. Consistency beats intensity. Step 2. Timing is everything. Drink it 30 to 60 minutes before lying down, not right at bedtime. Step 3. Test your fasting glucose every morning and track the trend. Your meter is your truth. Step 4. Tonight, go through your pantry. If you have flavored teas with natural flavors, golden milk in a carton, or Glucerna, throw them out. You now know better. Of the 5 drinks I shared today, almond milk cinnamon, chamomile ACV, bone broth, Tart cherry water, fenugreek tea, which one will you try tonight? Type the name in the comments. And if there's someone in your life who's frustrated by high morning blood sugar despite doing everything right, send them this video. They deserve to know what actually works. I'm Dr. Vivian Hart. This video is for education only. Do not adjust your insulin, metformin, or any diabetes medication based on what I've shared. Any change to your prescriptions must go through your doctor. Sleep well, and I'll see you in the next one. Subscribe and stay close.